therapist. You can find me at movementthinker.org. Today we're going to cover an exercise that some people just have a lot of trouble doing. Again, a little bit of background on me. Former powerlifter, former strength athlete, former strongman, former personal trainer. And one thing that we notice that patients have trouble doing is this. Right? They don't know how to move their shoulder blades without moving their arms with it. Right? Like they can pull their shoulder blades together if they bring their arms back, but they can't just pull their shoulder blades together. And gosh forbid you ask them to pull their shoulder blades down, because many patients can't do those simple motions. And the shoulder should move freely. The shoulder girdle there, the shoulder blade, should move freely on the back. There's nothing holding it together. I mean, there's some muscles attaching it down, but it's not tacked in, right? You know, there's nothing holding it on there. And so it's free floating, right? It should be able to move forward, move back, round up, round down. And we have to teach that to some patients, because when they've habitually been in this position for a long period of time, they have absolutely no clue up here how to leave it or how to leave it, right? Small motions, but these small motions play huge roles in your ability to move. And I'm going to give you a quick example. And this is a common example that you'll see in a PT clinic. If your shoulders are forward, right, that's as far as my arm can go up overhead, because, ooh, actually get a cramp doing that. Huh, wasn't expecting that. If your shoulders are rounded forward, I was pushing pretty hard trying to get through it. If your shoulders are rounded forward, it's hard to get your arm overhead, okay? But if your shoulders are back, it's very easy to get overhead, and you can actually see the difference in the range of motion. I don't know, somewhere over here is where I was at, versus over here, right? It's a different range of motion, and it allows me to do more things during my daily life when I can move my arm here instead of having the limitation of only being able to move my arm here. And so one of the exercises that was taught to me, I'm going to show my age, in 1999 or the year 2000, by Dr. Jack Barnathan, who is a chiropractor out of New York, used to work closely with Arnold Schwarzenegger, worked very closely with the International Sports Science Association and Dr. Fred Hatfield in Salaria. This exercise was shown to me at Quads Gym in Wrigleyville. It's like the mecca of gyms, right? Quads, gotta love it. And it's simple. You grab the bar. Sorry, when I start talking powerlifting and gym, I get excited. Okay, so you grab the bar. You change the space between your shoulders and your ears by really reaching for the sky. And then you try to change the space between your shoulders and your ears by pulling your shoulders down. This causes what's called a depression, or a downward movement of the shoulder blade, which works a muscle that people don't tend to use very often, called the lower tract. Okay? If you do not know how to pull your shoulder blades together, this is very hard. But if you just think of little motion, or little space between ears to big space between ears, that will help you perform this motion correctly. Your shoulder blade and your shoulder girdle should move, and it should move freely. I always got to watch it because I'm going to peg myself with that bar there. Your shoulder girdle should move freely, and if it can't, the goal is make it move freely. Okay? Sometimes you can use weights to do that. Sometimes you can just get all loosey-goosey and, you know, do one of those dance moves. But really, your shoulder should move forward and backwards, up and down, with no problems, because it affects your ability to raise your arm overhead. Live well, move well. Thanks for watching.